So we'll move on to the next question, Doctor.
Hello ma'am, I am Varsha, working at Dublin Healthcare. Could you explain what are the methods to avoid pregnancy?
Well, that's a question which is actually the reverse of what you asked me earlier. What are the methods to avoid a pregnancy? Well, it depends on how long you would like to avoid a pregnancy for. If you have any children, do you have any medical problems in your background, or is it something which is for a very short period? So if you have infrequent intercourse, or if your partner or husband is not around most of the time, something like a condom is very more convenient because it is user dependent. That means you would use it only when needed. Whereas if you are in a steady relationship, probably the oral contraceptive pill, that's the pregnancy pills which you take on a regular basis, would be the most useful and safe. If you have had children and you would like to avoid pregnancy for a fairly long time, say around 3 to 5 years, maybe something called as a copper T, which is a coil which is put inside the uterus or the womb, would be the most practical option.
And it's the intrauterine devices.
That's correct. Okay. And it's always good to get a consultation with a gynecologist or a doctor to find out what is the best method suited for you. So it's a short visit, and most of these things can be finalized in one visit itself.
Okay, so I think, Doctor, you have talked about the contraceptive pills, the oral pills. So is there any side effects of using that?
Well, you are probably not the first person asking me that question. Nearly everybody who comes to me asks me, Doctor, does this cause any problems? But maybe I would probably answer them, look, if I had to give my wife a contraceptive method, I'd probably give the contraceptive pill, because the chances of it causing problems is very, very less, and it's very, very effective. And in fact, more than 100 million people all over the world have used the contraceptive pill without major problems. Yes, some people do have minor problems, but most of them are not of a severe nature, and in all likelihood a doctor can predict a problem based on your medical risk factors and whether a pill is suited for you or not. Moreover, you have different types of contraceptive pills, so it's something which is not just for the same population everywhere. So a certain person, say if you have had a child, you might get a different contraceptive pill. If you are older, you might get a different one. So there are different preparations which are there.
Okay, so it all depends on your health problems and the circumstances.
That's correct.